have joined us or are joining us in webinar 186. Uh, since the Andean Health Organization Convenio Hipólito Unanue started the webinar series in May 2020. On this occasion, we are pleased to present the new series of international innovations in health with the second topic, challenges and innovation in tuberculosis. The Andean Health Agency is committed to working for the health of the Andean region, together with the ministries of health of Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. The COVID-19 pandemic has also taught us that the capacities built and strengthened in these years must not be disregarded, and health must continue and remain at the center of the policies. That's very important. Health at the center of policies, research, epidemiological and genomic surveillance, vaccine and drug developments, and the deployment of health promotion and prevention measures are essential for a well-cared society. Reflections on these and other priorities that are relevant to health and well-being can be found in the monthly Notis Salud Andinas newsletter. We have a monthly edition which is available at the uh, Andean Health Organization's website. We would like to invite you to please leave your name, your organization, and country in the comment box of the Facebook Live chat or the YouTube Live chat. In the same space, you can leave your questions or send them through the email webinar@gmail.com. In this webinar, we will follow the usual dynamics. We will start with the institutional greeting, then we will have the lectures of our speakers, and then we will go to a Q&A session. To access the certificate of attendance, as usual, in any of the chats of Facebook Live or YouTube Live, you will find a fixed link where you must fill out a brief survey and leave your data. Please, if you send this information by email, check that the email address is correct. And then once we receive this email, we will send the certificates to your emails in a few days. Now I will give the floor to Dr. María del Carmen Calle Dávila, Executive Secretariat of the Andean Health Organization, who will give the welcoming words. Dr. Calle, you have the floor. Thank you very much, Marianela. Well, we are very pleased to have this webinar. I have lost count. I think it's number 186. Yes, it is number 186 actually. The 186 webinar that this organization is conducting since May 2020. Well, tuberculosis, as we know, is a current public health problem. Its concentration in especially vulnerable populations added to the impact of the pandemic by COVID-19 has undermined the progress that the countries were making towards its elimination. For the Orasconu organization, facing tuberculosis, stimulating research, making use of the evidence found, and strengthening the joint strategies as an Andean region are a priority. Thus, we have an Andean committee to end tuberculosis made up by the people in charge of work on TB and the laboratories in charge of TB in the 6 Andean countries. Despite all the efforts done in this regard, there is still a huge gap between the current reality and the expected reality. The World TB Report 2022 from the WHO shows us that this is the first time in many years that the number of people contracting the disease and who are infected by drug-resistant bacilli is increasing. So what has happened in our Andean countries? Before the pandemic, with the strategies implemented by the Andean countries, there was an increase in the coverage of diagnosed TB cases. The percentage of abandonment to the treatment abandonment, however, was high and even higher in the cases of resistant TB. With the pandemic, TB case detection in all its forms decreased by 20 to 30% in 2020, therefore increasing the community transmission of TB in the face of a decreased detection of active TB cases. Case detection in all its forms decreased 20 to 30%, around 20 to 30% in 2020, increasing the community transmission of TB because due to the decrease in the detection of active TB cases. With the strategies implemented by the countries to close gaps such as active search, the establishments of itinerant modules, field work, community surveillance, decentralization of services, healthcare to migrants, online follow-up, updating of guidelines, training of human resources, health human resources, establishment of observatories, among others, the Andean countries have managed to increase the detection of TB cases as compared to 2020. However, treatment coverage and the success rates are not as high as expected yet. We have not yet recovered the TB preventive activities such as contact control at the levels that we had before the COVID-19 pandemic. In this context, it is essential, critical to strengthen the efforts that we make to maintain and surpass the achievements made to date in order to be able to address the persistent obstacles that have led to an uneven progress in the fight against tuberculosis. Let's remember that in the third pillar of the End to TB strategy, referred to research and innovation, we recognized that achieving considerable reductions in incidence and mortality will require the development and introduction of new tools and new technologies, as well as the promotion of universal access to the existing technologies and a better use of these. These new tools and technologies include rapid point-of-care tests to diagnose infection and disease and detect drug resistance. Shorter and safer treatment regimes to treat tuberculosis infection and drug-sensitive tuberculosis. A shorter, safer, and more effective treatment of drug-resistant TB. An efficient tuberculosis vaccine before and after exposure and across a wide range of age groups and geographical settings, as well as innovative strategies to address the social and environmental drivers of tuberculosis, key issues that still run into a number of obstacles and difficulties. I mentioned that tackling TB is a priority for the Andean countries. This is the reason by which since 2017 we have had the program strengthening tuberculosis laboratory diagnostics in the region of the Americas, that proved and funded by the Global Fund to fight against AIDS, tuberculosis, and malaria, which aims to contribute to improving the quality of the TB diagnostics in the laboratory networks in the Americas by strengthening the installed capacity in the region. This program is executed by the Andean Health Organization, Hipólito Unanue Agreement as the main recipient, and with the Executive Secretariat of the Councils of Ministers of Health of Central America and the Dominican Republic, and the PAHO, the Pan American Health Organization, as subrecipients. In this special cycle of conferences, we present this webinar, Challenges and Innovations in TB, that seeks to strengthen the process of timely and quality diagnosis and the use of technology and innovation in this regard. We would like to thank Dr. Walter Curioso from Continental University, Dr. Lourdes Usunoki, General Coordinator of the Program Strengthening TB uh, Diagnosis in the Americas, Dr. Roger Dayal, professor and head of the Department of Pediatrics of Media College in Agra, India, and member of the Standing Committee of the International Pediatric Association. Welcome to you all. Thank you very much. Thank you very much, dear Dr. Calle. After the greetings from our Executive Secretariat, I will introduce myself. I'm Marianela Villalta. I'm a physician and I'm in charge of the Andean Tuberculosis Committee of the Andean Health Organization. And today, with great pleasure, I will be in charge of moderating this webinar. After this preamble to present the challenges in the timely diagnosis of TB from the regional experience, we would like to kindly welcome Dr. Lourdes Kusunoki. Dr. Lourdes is a pediatrician. She has a master's degree in social management. She has doctorate studies in public health and a master's degree in hospital and clinic epidemiology. She has a postgraduate degree in health technology assessment and economic evaluations. She has a diploma in governance and public innovation for leaders in Latin America and the Caribbean. Dr. Kusinowski has a large, extensive experience in the management and conduct of programs, especially HIV. She was the director of the National STD and Control Program and AIDS program as well from the Ministry of Health of Peru. In Horas CONU, she has coordinated the Committee of Medicines, the evaluation of health technologies, HIV, and safe blood. And she has also participated in the development of proposals for the different rounds of the Global Fund. She's currently, as we have already mentioned, she's currently the coordinator of the project for which Horas CONU is the main recipient, strengthening of the network tuberculosis laboratories in the region of the Americas 2017-2019, and with the program strengthening TB laboratory diagnosis in the region of the Americas 2020 to 2023. Dr. Kusinowski, you have the floor. Thank you very much, Marianela. It is a great pleasure to share this webinar with Dr. Curioso, Dr. Dayal, and we hope that we will be able to provide as much information as we can, the information, of course, that we have available based on our experience. Can you share my presentation? I'm the General Coordinator of the Regional TB Project, and in this opportunity, we will discuss the challenges and innovation in TB. And we will be also asking the question here, why discussing this topic? Next, please. Next one. Next one. Okay. Well, we say, why should we discuss this topic? Well, why? Because TB, as we have mentioned, is the main cause of the higher number of deaths in the history of humanity. It is a very infectious disease and one of the main causes due to death because of resistance to the anti-TB drugs. In the research area, we have had many achievements, but which are not sufficient yet. The response has been very slow and insufficient from the economic standpoint if we compare everything that could be done in terms of COVID-19 in a very short period of time. In the 67th World Assembly of the Health in 2014, the member states adopted the World Strategy NTB strategy and the targets for control, prevention, and work with TB from 2015 through this strategy that it's established at the worldwide level. We have including the intensification of the fight against TB and achieving the end of the epidemic at the worldwide level, as well as we have considered the expression and the TB epidemics as a goal in the third sustainable objective goal established by the United Nations Assembly in September 2015. Next one, please. The NTB strategy is very well known by all of us. The objective is to end the TB epidemics. It considers a comprehensive approach, social and health interventions, but always taking into account the regional, national, and local contexts because each one varies and each one is different from the other. It is necessary that the countries strengthen their social sectors, their health sectors, also achieving a health coverage and universal health protection. All these things that have been proposed, it's still insufficient, however. Therefore, we need new tools for diagnostics, treatment regimes, vaccines, in order to achieve the milestones and the objectives that we have set. All the countries have commitments and targets to comply in the framework of this NTB strategy. We have milestones. We have the milestones for 2025. We have targets for 2035 as well. Well, here you can see the 10 main priority indicators for the follow-up of the implementation of the NTB strategy. We have the commitment of the laboratories in 2 indicators out of the 10, the percentage of the new TB patients diagnosed through the rapid diagnostic test recommended by the WHO. And what we will see in this indicator, well, you can see this chart. We see the progress made in the average of rapid tests conducted since 2018, which is 19%. And then we have in 2023, 21, which is 30%. However, we are still kind of far away from the targets that have been set by the WHO that because we should be diagnosing at least 90% of the TB cases through a rapid test, particularly with those countries that have reached getting to 90. Some others are very close, but a very large majority of the countries are still pretty far away from this achievement. The other indicator is related to the coverage of TB patients with results for the DSTs. We have very important events in this fight against TB. One of the important events, is the first worldwide conference of the WHO and TB in the Times of Sustainable Development held in Moscow from November 16, 17, 2017. And then we also had the high-level meeting of the General Assembly of the United Nations held in 2018. Both when you check and review the agreements or the statements made by these 2 meetings, both of them agree in promoting science, research, innovation, recommending that we should increase the capacity and funding at the national and regional settings as necessary to expand the quality research and multidisciplinary research and applied research as well, establishing or reinforcing the national TB research networks without leaving aside the community mechanisms and especially the participation of the civil society. We should also strengthen the surveillance systems, improve the collection of data at all levels through innovative approaches in surveillance in the research programs against TB. The other meeting of high level against TB will be held this year in September 22nd, 2023 in New York. This meeting, let's remember, is being held after the beginning of the pandemic of COVID-19 situation that affected extensively the work that the countries were doing regarding TB and which had an impact in the indicators at that time. The topic of the meeting is to promote science, finance, and innovation and in order to end the TB world epidemics, in particular, guaranteeing equitative access to test and care. If we see in the three meetings, they always mention the promotion of innovation. And the most important thing is not only the commitment and that the country signed the declarations of this event, but we need a real and sustained commitment that should be translated in assigning budget to conduct the necessary activities, because there's no use in signing a document, because if you don't have a budget, you cannot really do anything. Next, please. One of the pillars, which is innovation and prevention, and to care and prevention, and bold policies and support systems. Apart from innovation and intensified innovation and investigation, we can see that research in terms of vaccines technologies still have many obstacles and many deficiencies ahead of them. And therefore, it is urgent to achieve technological advancements from here to 2025 in order that we can make the incidence of TB to decrease in a more speedy manner. However, for all of these, we need a multi-sectorial approach. In the context of Pillar 3 of this strategy, there are two multi-country projects have been developed, funded by the World Fund, in which the main recipient is the ORAS, the Health Andean Health Organization, the PAHO in Washington, and the COMSICA. They are the sub-recipients. These are projects, as we can see, have been funded. The second one is still being funded by the World Fund, with the results that have been obtained and based on the experience of the first project that was done in 2017-2019 with 20 countries. The World Fund requested the Andean organization to submit a new proposal to follow the commitments of sustainability of the countries that were members or took part in the first project. In that sense, then, the same institutions, we prepared the second project that we started in November 2020 up to October 2023 with 17 countries. That is, this October in this year, we are finishing with the implementation of this second project. This new regional grant for TB with 17 countries is also targeted at the strengthening of the TB labs. One of the most important topics actually is sustainability. That is, each country should take the cost of the functions that the national TB reference labs should comply with. We are also promoting the implementation of diagnostic methods recommended by the WHO, and to improve the information systems. Then we will mention some progress made with these two projects. Next, please. So which are the new tools and technologies? Well, in order to achieve the reduction of incidents and the number of deaths due to TB, it is necessary to develop and introduce new technologies, especially and not only the introduction to prepare or develop new technologies or invent new technologies, but it is also important having access to those technologies. Access and adequate use as well, because there's no use in having technological progress or advances if there's no budget to buy them, to acquire them. Currently, we are TB equipment for TB diagnosis are being purchased, but the problem is that in the national budget they are not including the maintenance of this equipment or the warranties, which in the long or mid-term will stop functioning. We recommend that at least this item is considered in the budget of the countries. As I said, it's not only about having the technology, it's about buying the technology, but also it is about budgeting or provide budgets for their maintenance, the maintenance of this equipment. Now, with regards to which are the tools and technologies, well, Marinela has already mentioned this, Dr. Larrati, the therapeutical regimes, briefer, shorter, and TB vaccine and innovative strategies. What I want to mention is that the two TB projects they have not had incidents in these technological advancements. We have supported, well, what we have done is to support everything that is related to the rapid test for the diagnosis and detection of resistance. That is, with the project, we have not made any innovation, we have not created any piece of equipment, but what we have helped with is that we have supported the application of the rapid test for the diagnosis and detection of resistance. Next, please. Well, with this second project, TB project, what have we achieved? We will mention here, especially we will mention especially the second project. What is important is that from this project, what we have been able to do is to do some advocacy at the high level, that is with the authorities of the ministers of health, ministers of health secretaries, as appropriate. We have had meetings with the 17 countries, and with some of them, we have had even a second round of meetings. We have managed to have commitments, to achieve commitments through the organizations, and then at the individual level as well, with countries that are not part of an integration system, but which are part of another system, which are not ORAS or SECOMISA. In the advocacy area, uh, but with political commitments and funding, with the ministers of the Andean area, we have obtained 2 resolutions signed by the ministers of the Andean countries. This indicates that TB is a topic that has been taken into account in such an important meeting that it's REMSA, the meeting for political commitments and funding of the countries. The countries that are part of this Central America and the Andean area, the ministers have committed expressly to improve the quality of the diagnosis methods and to implement the recommendations of the WHO in terms of the TB diagnosis. We have the resolution 40 of November 25th, 2026, 2022, which is the adoption of recommendation of the WHO for the diagnosis of TB, and the other resolution 560 of REMS, which is strengthening of the quality management system in the laboratories. At the level of SECOMISCO, we have the resolution signed in 2023 regarding the sustainability of the national reference laboratories of public health of the states members of SICA, and resolution 202-2023 on the preparation of the regional strategic plan of TB in Central America and Dominican Republic. What it's important is that in these resolutions, in the case of the Andean area, are maintained as a framework to conduct activities. In the case of COMISCA, the SECOMISCA, these are binding resolutions, binding that have to be implemented. They are binding, compulsory. Next one, please. Another thing that we also did in the second project, and that for us and for all the people from the laboratories and the ministries, it was very important, was to conduct a study to see how the 13 functions that the TB lab should fulfill, how they were being funded, plus the 5 functions that they would have as the head of the supranational network for their countries in years 2021, 22, and 23, always collecting data from the previous year. The results obtained give us information of what is the gap to be funded still. This gap that has not been funded, right? Here we have the necessary budget, the allocated budget, and you can see that for 2022, we have a gap of 33%, 12% more than in 2021. This is a very important exercise conducted which gives evidence on the need to fund the laboratories, just the TB labs, and which is pretty useful for the advocacy activities vis-a-vis or with the national authorities. This information also comes from that same study, and here you can see that in 2022, the public funding in average for the 17 countries is less than 50% from what the labs need, and a 20% is taken by, or it's covered by some donations, and we still have some gaps. So these apart from the fact that these labs work with a public budget that is 50% less of what they need, this in reality doesn't create much sustainability, and it actually creates a lot of concern, because when there are no grants or donations, this gap will increase much more. Next one, please. Another topic is that in that same study, what we did was to see the gaps, but with functions.
Cumplir tanto los laboratorios de
The
referencia.
functions that the national reference labs and the supranational labs must fulfill. And what we can see here actually is that the gap, we have 56% of the gap, of the largest gap, is in terms of the information system of the laboratory. We have 65% in terms of external quality control and the permanence of the human resource. These three functions are the ones that have a larger uh, budget gap. This then it's important for our advocacy so that when the heads of the laboratories talk to the ministers, they would be able to tell them that they need more budget in the laboratory, specifically or particularly for the information system, for the external quality control, and for human resources. This information has been analyzed by each country and it has been sent to the ministers of health of the 17 countries that participate in this group as concrete evidence of what is needed for the to be able to fulfill the functions of the TB labs and to take measures in the short term, knowing the importance of these topics. The 17 countries have this information and they are using this as material for advocacy and as evidence of what is happening. Next one, please. With the funding, we have an extra funding of the C19 CRM for COVID-19, with which they bought gene expert pieces of equipment for these countries: Argentina, Chile, Colombia, Mexico, Guyana, El Salvador, Guatemala, Haiti, Honduras, Nicaragua, Dominican Republic, and Venezuela. This purchase was made last year, and we are still having problems with Colombia and Mexico because we have not been able to deliver the equipment to the country yet. This is important because many times you say, well, we need pieces of equipment. Yes, of course, we need pieces of equipment. We need equipment, but we need to do as much as we can to facilitate the legal processes in the countries so that these materials can be really delivered. We have a second delivery done for these countries, with which we have not had any problem. We have bought tests for COVID and for TB. And an important aspect is the operational research done with the civil society regarding the access to molecular tests and productivity of the gene expert teams. Even though this was something planned for 10 countries, it could only be done in 4 countries. We have had a series of administrative processes that needed to be done. They had to go to the ethics committees. The ethics committees take a long time in some countries. Coordinations at the central and peripheral level took too long. Uh, so we have been able to obtain results from Bolivia, Ecuador, El Salvador, and Guatemala that we are reviewing at this point to share this with most of the people. Well, to share this information with most of the people. Next one, please. One of the very important topics in this grant has been the training of cabinet certifiers or booth certifiers. We have 2 certifiers that were trained with in the first grant, one from Argentina and one from Mexico, and 5 in the second grant, one from El Salvador, 3 from Peru, and 1 from Colombia. Besides, because it's not only about having the certifiers, but we have equipped them with a series of pieces of equipment to certify the booth. We bought them from El Salvador, Peru, Colombia, and Argentina, and Mexico. We are calibrating this equipment every year, these cabinets, and we did the cabinet certifications with people that were certified in these 2 grants. The activity has been, the certification activity is very, very important, but in many countries, it's not being considered in the budgets. Now that we have certifiers, this is a great opportunity because they just need to coordinate with the Ministry of Health of the country, and they just need to cover the travel expenses, the per diem, and the cost of the equipment. They do not need to pay any fees to the certifiers. What I wanted to highlight is that even though it is true that you can buy the pieces of equipment, you can train certifiers, but you should also consider the calibration of this equipment, because if you don't calibrate this, these pieces of equipment cannot be used the next year. You have to calibrate them every year. Next one, please. We have also worked in the accreditation of the tests of the TB labs with 2 tests, actually. And it is important that we have worked with Argentina, Chile, Mexico, Colombia, Guatemala, and Peru. We have worked, we have prepared the quality system that now the countries have accredited. We have 4 of them, and the other ones are in process of getting it. We have also given courses, workshops, laboratory management, and accreditation workshop. These were excellent courses that have provided lots of information, and these courses need to be given again. They need to be replicated. Well, we have worked extensively in the improvement of the information systems. You know that the information system is something that goes a little slowly, even though we know that it's the source for decision making, both at the national as well as international level. But we still see that there are many difficulties that are related to the human resources that are not enough, with obsolete pieces of equipment, connectivity problems. We feel from this grant that we have contributed to make an improvement, but there's still a lot to do. We had 4 consultancy processes. We work locally. We had dashboards pre-created, but we feel that we still have a long way to go in this sense. It's important to pay attention to this problem and to be able to uh, make a proposal for solution and to consider this as one of the priorities in the countries, because I think this is a very difficult topic, very complex one, but there should be a way to try to solve these problems little by little at least. Next one, please. Well, to wrap up my presentation, I would like to highlight, to summarize what I have said with this grant. What are we leaving? What have we done with this grant? And what do we feel that we are leaving the countries with so that they can continue making progress? First, the supranational and national reference laboratories and the national programs. The heads of these labs and programs now have access to the authorities, to the top authorities. They have this connection with them and they can communicate their needs both to the authorities as well as the country coordination mechanisms that have worked hand in hand with us to create synergies, to be able to schedule, to be able to submit new projects to the World Fund if possible. We have made the estimations of the costs for the functioning of these laboratories, and this is pretty useful for them, useful to both to plan as well as to advocate for an increase in the budget. We are leaving 7 cabinet certifiers so that they will work with the laboratory network or any other country that might request their services. And apart from being certifiers, they have their set of equipment to conduct the certifications. We are leaving the countries with pieces of equipment and inputs for the improvement of the COVID TB diagnostic. We have bought gene expert equipment. We have 6 laboratories with strengthened quality management, 5 labs with 2 new accredited TB methods, and 1 lab with an advanced process. Next, please. We have people from the personnel of the laboratory have been updating their knowledge. We have updated protocols for research. All the 17 countries that have participated, each one of them, the person that has participated from the country, each one of them, they have made an operational research project. So what we need is that this operational research can be done, but with local funding. So we suggest that these research projects can be conducted, even though there is a country that has done so, and it's going to submit this in the Union Congress. We have published the structure and working of the structure of the laboratory networks. We have tools for the improvement of the quality of information available in 7 countries with technical assistance. Even though we have given them tools to improve the quality, we have worked with each lab, but the ideal thing would be that they use this and they will incorporate this in their system to be able to continue making progress in the improvement of everything that is information system. because it is very important, as I said previously, it is very important that through the information that you receive, you make decisions. And this information is not only national, it goes at the international level. The WHO makes decisions with information that the countries provide. We are living as well ministerial resolutions that are committed to, that have committed to um, strengthen the diagnosis of TB. There are two resolutions at the Andean countries level and two resolutions at the level of Secomisca that can contribute to comply with this or to achieve this improvement in the laboratories, TB laboratories. And one of the things that is very important is the greater involvement of the country coordination mechanisms. Many of them incorporate the civil society in the problems of TB and the synergies for the strengthening of all the components of the World Fund. We must highlight that Secomisca also has a regional coordination mechanism that provides great support to the implementation of the World Fund projects. Next one, please. Well, I would like to thank you. I think that with this information, I have given you sort of a screenshot of the things that we have made, the progress that we have made, and how we have contributed to technological innovation from the areas from the World Fund project with Secomisca, ORAS. We've worked with 17 countries, and I think that we are living at something that has been installed, but it will depend on the decisions of each country to continue with this. Thank you very much. And I'm here for your questions if there is any. Yes, doctor, thank you very much. I believe that it's very important to be able to continue strengthening the response. The program has produced many evidence, and that's very important. And the gap in diagnostic is very clear. You have mentioned several times, and it's very important, the word budget, the importance of working in networks, the management information, the information system, the surveillance, even the participation of the affected population. The program, in terms of contribution of evidence, the evidence lead to policies, and this lead to budget that will provide sustainability. And yes, indeed, in terms of diagnosis, in terms of information, in terms of budget, this great work or this concern of guaranteeing the accreditation of the labs. And I believe that this program has strengthened the involvement, the work, the importance of the laboratories, the training of the human resources in this bid to end with TB. Thank you very much, Dr. Kusunoki. We would like to thank you again for your presentation. Thank you very much. Congratulations. We have received some questions. We would like to invite you to stay here in the room, and at the end of this session today, we will have a Q&A session later on. For the next presentation on challenges in timely diagnosis of TB, use of technology and innovation, we would like to kindly welcome Dr. Dayal. Professor Dayal works as a professor and head of the Department of Pediatrics in the Medical College Agra in India since 2003. During his work, he created a whole department with 102 beds with intensive care facilities. It is important to mention that both the intensive care neonatal intensive care unit as well as the pediatric intensive care unit work at 100%, are 100% occupied. Dr. Dayal is a qualified professor, very well recognized. We have read all his or your resume, doctor. Wow, more than 20 years of experience, more than 200 postgraduate students that speak about you, that speak very highly about you, that have been trained by you, that occupy very important positions in India and the world. His main area of interest are the infectious diseases, especially TB and lepra. His studies, including his pioneering work on the diagnosis of lepra, are internationally recognized. He has worked as professor, assistant visit professor, and visitor professor in India, in Manila, and many other cities. He has more than 100 publications, author of chapters in the Red Book of the American Academy of Pediatrics. He's currently the principal investigator in the multi-center study that evaluates the impact of the anti-pneumococcal vaccine, conjugated pneumococcal vaccine in the pneumonia conducted by the Johns Hopkins University in the US in 2020. Dr. Dayal, as I have said, has more than 20 years of experience, and since 2002, he has been elected consecutively member of the Standing Committee of the International Pediatric Association. And well, your resume is very, very extensive, but I would like to mention the recognition that you have received for the exemplary work that you have done, providing you with the top award of the Medical Association of India, Dr. Binta Shankar Roy in 2016. Doctor, congratulations on this. And now you have the floor. We invite you to make your presentation. You have the floor, Dr. Dayal.
Thank you very much, madam. It's indeed a pleasure to be here and share the screen with stalwarts in the field of tuberculosis and in the field of pediatrics. Well, it's really very difficult to talk about tuberculosis and how to get on top of it, even after having worked in this field for the past 20 years. And when I was given this topic, that is challenges in the diagnosis and use of innovations and technologies, I said, well, I'll try to summarize and make a brief overview of what we look at in this part of the world, which is a bit different from what you do, and then give our suggestions and our outlines as to how we are trying to get on top of it. Could I please have my slides, please? Could I have the slides, please? Am I audible?
Yes, doctor, you're audible.
Could I have the slides, please? Can I share it on the screen?
En este momento.
Yes, we're working on that, doctor. 1 second, please.
Okay. Right. Thank you so much. Right. Could I have the next slide, please? Next, please. Well, first of all, greetings from my town, which is the city of the Taj Mahal, one of the 7 wonders in the world. If you should happen to visit this town, please do come and visit our institute, which is just about 4 kilometers. Next, please. Next, please. Now, this is the Global Tuberculosis Report of 2022, in which it has been mentioned that 8 countries accounted for more than 2/3 of the global TB cases, and with India having 28%, well, it's a sad scenario, and still we are not on top of it. Next, please. Oh, the screen sharing. Now, looking at the global scenario, which we are aware that before the COVID-19 pandemic, an estimated 10 million people fell ill, and of this, 7 million were diagnosed, leaving a diagnostic gap of 2.9 million. Now, this gap swelled up to 4.2 million in 2021 because of the COVID. Children 0 to 14 years formed 5.6% of the total TB cases. Next, please. The Indian scenario. The estimated incidence of all forms of TB in India for the year 2020 was 188 per 100,000. About 300,000 cases were reported in the pediatric age group. The total number of incident TB patients new and relapsed notified during 2021 was 19% higher than of 2020. This is the annual TB report of 2022. Next, please. India accounted for 32% of the total TB deaths if we look at the Global Tuberculosis Report of 2022. Again, a very sad situation. And if you look at the details, it was up by 2.8% in 2021 and up by 5% as compared to 2020. Next, please. Now, this is a unique program which we have in India, in which the notification of TB is being strengthened, and all government and private sector doctors are being encouraged and, in fact, coaxed into providing the data of the TB patients that they are diagnosing and treating. Now, the people newly diagnosed and reported notified with TB in 2021 was up by 21% compared to 2020. Now, India reported the highest reduction in reporting from 2019 to 2020 across the globe. In 2021, this reduction was arrested to some extent, but still left a lot to be desired. And we see this is only because of the COVID situation. Next, please. India has the highest number of drug-resistant TB cases in the world, 26% of all global cases. The people diagnosed with drug-resistant TB in 2021 was 18% more as compared to 2020. People started on treatment for drug-resistant TB in 2021 was 25% more as compared to 2020. Next, please. We can skip this. Next, please. Neglect of child TB. Children with TB rarely die when treated, but 90% who die from TB went untreated. Children with TB are less infectious than sick adults, so they are often given low priority. Children with active TB are harder to diagnose as there are relatively few bacteria in the system. Next, please. Simply put, if we cannot find TB, we cannot treat TB. And if we cannot treat TB, we cannot end TB. Next, please. Now, this has been a brief account of what's happening in the Indian subcontinent. However, to plan the strategies and to move forward, well, one cannot say that what is applicable and what is okay for the Indian subcontinent, or for that matter, Southeast Asia, is going to be valid all over the world. One size fits all is not going to be the policy for getting on top of TB. So coming to the lab diagnosis must be viewed in context of the finding of missing cases. Emphasis is on increasing the percentage of TB cases confirmed bacteriologically. And we know that the range of diagnostic technologies under three broad categories: diagnosis of TB with resistance, additional drug resistance, and without drug resistance. Next, please. We are aware that the expert test has been there for quite some time. However, we are very interested in the looking of results of expert tests in the stool samples. I shall be presenting my small study a little later, because in a country of the size of India and in the Southeast Asia region, where TB is so rampant, we have to look at alternative strategies rather than just going by the gastric aspirate and doing the gene expert test. Next, please. For additional drug resistance, we have the SLLPA and the high complexity reverse hybridization-based NATs, which may be used on MTB culture isolates for detection of pyrazinamide resistance rather than the culture-based phenotypic DST. Next, please. Next, please. Next, please. Right. Now, I do not want to go into the details of these WHO protocols. What is just suffices to mention is that the starting point is the WRD testing, that is the gene expert, or urine LF-LAM if available. Now, this is a nice WHO scoring system which has been there in those low-income countries where one has to rely on not only the test, but the signs and symptoms of the chest X-ray. This is a very nice scoring system which has been there for those countries where one has to rely on signs and symptoms in chest x-rays. And they have a scoring system of more than 10. Next, please. This is the same chart. If no chest x-rays are available, this could be used only on the basis of signs and symptoms. Of course, we have the testing there, but if it's not performed and it's not available, one can go by this and with a fair degree of accuracy. Next, please. The diagnostic algorithms for diagnosing pediatric pulmonary tuberculosis in India, well, it starts with the chest x-ray and then moves on to the NAT. Next, please. For lymphadenitis, it starts with the FNA cytology and moves on to the NAT. Next, please. For TB meningitis, the flow chart follows. Next, please. Next, please. Next, please. Right. Now, the challenges. If we look at this chart, it shows the barriers on one side and the enablers on the other side. The barriers can be the patient level barriers, health facility level barriers, provider level barriers, data management barriers, and how do we try to get on top of it? Next, please. The challenges in the diagnosis still, the patient level barriers include direct costs, the patient pays for the test, indirect costs for transport, food, education and community awareness, mistrust in the health system, stigma, and fear of disclosure. Next, please. Next, please.
Doctor, no se le escucha.
Sorry, doctor, we cannot hear you very well. We're having problems with your audio.
Qué pena, porque estaba súper interesante.
Sí, es probable que
It's a
nuevamente
pity. It was
pasó esto
be
temprano.
very interesting.
O si no tenemos plan B.
He might reconnect. Let's wait for him. Let's give him a couple of minutes to reconnect.
Ajá. Doctor, ¿cómo está? No le hemos escuchado la última parte.
Doctor, we couldn't hear the last part of your presentation. We lost your audio.
¿Nos escucha usted, doctor?
Can you hear us, doctor?
Estábamos en los desafíos, doctor.
We were
desafíos a nivel del paciente, el costo que
We
conlleva,
stay at the
perdimos.
challenges at the level of the patient, the cost for the patients, and that was the end. Yes, now you are audible. Yes.
Up to you.
Sí, está intentando comunicarse. Doctor, ¿cómo está usted?
Hi, doctor.
Yes, am I audible, please? Can you hear me?
Yes, I can
Okay,
hear you.
let's
We
go
can
on.
hear you.
Yes, lovely. I'm sorry for this interruption. Could we go on with the slides, please? Or if I could share the screen, I think that should be better. We'll go faster. Can I share the screen?
Así es.
Yes, you can share your screen, please.
Sí, por favor, indíquele que sí. ¿Cómo se
Yes,
siente?
yes.
Okay.
Yes, you can share your screen, doctor.
Okay. उसमें desktop उसमें desktop है. Desktop. Can we please continue with the slides?
Sorry, doctor, I couldn't hear you very well. You want them to continue passing your slides?
Sí, están puestas las diapositivas, pero no veo al doctor. Intentaré comunicarme por el interno. ¿Me parece? Sí. Quizás sea por la cámara, ¿no? Lo que podemos decirle es que apague su cámara, ¿sí? Para que entre por llamada.
Justo cuando se estaba poniendo mucho más interesante.
Sí, no quisiera cortar porque quería pedirle al doctor Walter Curioso, pero el doctor Dayal está intentando ingresar, ¿no? Entonces está haciendo todo el esfuerzo. Doctor Dayal, a ver si se conecta, si no para poder pasar con otra presentación, pero creo que el doctor Dayal en la primera parte nos muestra en realidad que la situación es preocupante, ¿no? Y descata dentro de
Well,
población.
let's see if Dr. Dajjal can reconnect. But it's been a very interesting presentation. He has highlighted the importance of children in this, and something to highlight as well. It's very important, and if we do not look for, we won't find. It is important how he has been telling us what is the approach to TB in India and these large challenges uh, that they have to deal with and that we'll have to deal with. Dr. Rajet Dayal, can you hear us? Dr. Dayal, can you hear us?
Doctor Walter, ¿usted nos permite continuar con esta presentación con las disculpas del caso? ¿Te parece? Bueno, apenas el doctor Rayal pueda, hay que dejarle un
Well,
mensaje, por favor.
we will leave a message to Dr. Dajjal, telling him that as soon he can come back, we will continue, but we will go now with our next presenter, with Dr. Walter. So it is a great pleasure for us to present Dr. Walter Curioso. Doctor Dr. Rajet, can you give us a couple of minutes to continue with Dr. Walter while we solve your audio problems? Is it okay with you? If Danaya could help us in this communication with Dr. Dayal. Dr. Curioso is from the Washington University in the United States, a surgeon, and it has a master's degree in public health by the same university. Dr. Curioso is member of the Digital Health experts group of the WHO and affiliate professor of the School of Medicine of the University of Washington in the United States. Currently, he is the vice president of research of Continental University in Peru. He has more than 20 years of professional experience in the public and private arena in topics related to digital health. He's an international consultant in IT and communication in health, telemedicine, telehealth, and public health for institutions like the Pan American Health Organization, the Economic Commission for Latin America, the ECLAC, for the United Nations, the Medical IT Institution of the United States, the National Institutes of Health of the United States, and the IDB, the Inter-American Development Bank. He has experience in public management, university teaching at the postgraduate level, and has led many national projects in the field of electronic health. He has published more than 130 papers in the main um, journals and books at the national and international level. He was Vice Minister of Policies and Social Evaluations of the Ministry of Development and Social Inclusion meetings in our country, and he was also advisor to the Ministry of Health and General Director of Statistics and IT of the Ministry of Health. Previously to that, he was a Deputy Superintendent of the National Superintendency of Salud. Dr. Walter Curioso, it is a great pleasure for us to have you here in this presentation. You have the floor, please. Thank you. Of course, thank you very much. First of all, I would like to express my appreciation, first of all, to Dr. Maricarmen Calle, Executive Secretary of the Horas CONU, and Dr. Marianela Villalta as well for the very kind invitation. For me, it is a great pleasure to be sharing this very distinguished panel with Dr. Lourdes Kosunoki and with Dr. Nayab as well. Today, I'm going to discuss one of the angles of the different aspects of this topic, which is very wealthy to discuss really, but today we will focus on one of the applications of the technologies during the TB diagnostic process, which is actually how can we apply AI and innovation to optimize this process. First of all, I would like to give an introduction to AI. I'm going to share with you at this point the definition given by the Ministry of Health. It is included in the digital agenda of the health sector, and it defines the AI as the field of health that uses algorithms and software techniques to predict the situation of human health through the analysis of a set of medical data. In all these digital agenda, there is a specific objective that has to do with the implementation of both big data systems and artificial intelligence systems for the analysis, real-time analysis of data that will allow, on one hand, to improve the efficiency of the public spending, but also to improve the quality in the healthcare services, which is critical, really, because we hope and we expect that technologies, well-implemented technologies that follow the guidelines and the ethical considerations might be able to improve the quality of life of our patients and the citizens in general. The framework of the Ministry of Health is related to other frameworks that we have in the state. Indeed, the Secretariat of Government and Digital Transformation, that it's under the presidency of the Council of Ministers, established a national AI strategy in which, on one hand, they consider the technological infrastructure, data, the economic model, but they also consider the ethical aspects and two very important components, that is the collaboration and another component that it's also critical, which is training, the training of the human resources in order to promote these changes. Actually, and very recently, there was a law passed, Law 31-814, which was passed and which promotes the use of AI in favor of the economic and social development of the country, where it declares these of national interest and promotes the use and the development of tools and artificial intelligence services for the improvement of public services of both health, but also for other fields like education, economics, inclusion, social programs, safety, security, etc. This is a field that, as we can see, it's emerging from the regulatory standpoint. However, in the world, this is a topic, this is a thing that has already been developed. Actually, if we look at the story in the 50s, in the history in the 50s, when we had the first AI projects that then evolved in the 80s, we had the machine learning or automated learning, as it is also called, and more recently, in around the decade of 2010, there was another technology, which is a subtype of machine learning, which is the deep learning. And we can define it as diverse neural network chains that make up complex structures, sequential structures in different setups, and have different roles. I would like you to keep this concept of deep learning because we will be discussing these in the framework of one of the TB processes. The introduction made by Dr. Kusunowski and Dr. Dayal as well on the different challenges that we have during the process to diagnose a person with TB are different, are very complex, and they involved as well many different components, social, environmental components. Actually, additional to the lack of access, the little availability of human resources, the little availability of technologies in the different health facilities, actually, we see how can we optimize this diagnostic process by using the resources that we have currently. It's been already some decades in which the use of cell phones for health applications had been emerging. Actually, Peru was one of the 5 countries recognized by the United Nations that started using cell phones for different healthcare processes, and it's still current. How can we then innovate? How can we then improve the process using the technologies that we have and also having the resources that the health facilities have? Many of them, as we can see in the right photo, they have basically X-ray reader in the health facilities. Let's remember that in many remote areas, in rural areas, they do not have specialists either. And if there are physicians, there might be even physicians in training, and many of them might not have the experience of a specialist in reading or interpreting X-rays to be able to diagnose with accuracy a patient that has a TB diagnosis. So in that context is that we decided to apply, and innovate with some technologies. And for that, we use a subtype of AI, which is convolutional neuronal networks, CNNs, which uses an artificial network to analyze visual images. One characteristics of these convolutional neural networks is that they are very effective in the recognition and classification, identification of patterns, and it's one of the preferred techniques to analyze medical images. The thing is that with a radiographic plate and with the algorithms, the idea is to be able to create some layers of identification that would allow us to identify patterns and classify the different manifestations with which TB can appear. With what objective? The objective is that in a health facility that has radio X-rays, the person that is in this process that might be a physician, let's see, a trainee, or it might even be a health professional like a nurse. The idea is that they can take a picture of this X-ray, this film, and through an algorithm that is in an application, they will be able to automatically detect the pattern or the abnormal patterns that suggest a possibility of TB. Right? For this, using these convolutional neural networks, this will allow to recognize abnormal manifestations, in this case caused by TB. This project involved different stages. One of the first stages was actually validating the algorithm, and for that we involved specialists, international specialists. Actually, we had the collaboration of the Ohio University, the Boston University, and the researchers, investigators, multidisciplinary investigators from computing science, from pulmonology, etc. And it was one of the first components, one of the first achievements that we got was to validate the algorithm. And for that, based on this study published in 2017, we achieved an 85.68% of classification accuracy in a large TB image data set, which at that point was a very important finding, and that for that moment it kind of surpassed any analysis that had been done before with a similar technology. The comparisons of the images, this was done with X-ray plates that were done on Peruvian patients and which were provided by Partners in Health, actually, and Socios en Salud, which actually was one of the strategic partners for this work. The second thing was, how do we validate this algorithm and how do we apply this project in a Peruvian population? And for that, we followed a model with a technical system approach. And this is very important because even though technology might play a very important role, we should not forget that we are a part of a system. And as any socio-technical system, even if it's true that we consider technologies and tools, we also have some other very important or equally important elements, starting from our processes. If our processes are disorganized, incomplete, and we introduce technology, the only thing that we will make is continue with the chaos, with the disorganization. So we need to first evaluate our processes, and then if we find something to improve or a redundancy, it is important to optimize them before implementing a technology. And for this, we need to also consider organizational factors, the culture of the organization, which is very important, and the infrastructure component or the environment surrounding this work system. And with this, we will as I said, we will be looking to optimize, as I said, not only the diagnostic process, let's remember, and this has been very well explained by Dr. Kosunoki and Dr. Dayal as well. Let's remember that timely diagnosis will allow for an early start of the treatment, and with this, we will be able to achieve a better recovery of the patient. After this socio-technical system, we validated this. This was done using a mix of methodologies that included as well qualitative methodologies, including observational studies, in-depth interviews, and focus groups. As part of the results, well, there was this whole process of validation of different health facilities in the DIRIs here in Lima, and we have published as well several of these progress achieved. Additionally, we also prepared a repository of images that are very important as well, because they could also have an effect and an important use actually for the training of human resources that as well, we said is critical in this whole process. And we also have a summary of the different studies that were conducted based on this project that it's been published in this paper, which is open access, entitled AI and innovation to optimize the TB diagnosis. And you can access this article. It is available for it's publicly available. Anybody can access it. However, it is important to mention that the AI also has other applications during the process for diagnosis, and even during the treatment and in different processes when we discuss TB. Today, we had an example to optimize the diagnostic process using the X-rays, but it also has AI. Well, it can also work with different other inputs, like, for example, the genomic sequencing, or using MRI or CT scans or microscopic films, and all of these using different techniques. And this is very important because the success for using these AI tools depend extensively on the quality of the data that we use as input. Therefore, it is very important to highlight what Dr. Kusunowski mentioned, which is the quality of the information is critical. And this It's not only useful for the diagnostic process, but also to predict or to identify other risk factors, evaluate evidence, hospital stays, or even to be able to map or to integrate, well, nowadays, something that is very important, which is the pharmacogenomics, right? As a second aspect, I would like to also mention that the technology is not isolated. It's part of a system. We have conceptualized this and we have called this a digital house, in which even though technology, software is important, but let's not forget that we rely on an infrastructure, but we also rely on another component that it's the infrastructure, which is the health information platform that it's combined with governance, with planning, with execution, monitoring, and evaluation, and the component, the people and culture component, these, the digital home that it's in the digital agenda of the health sector 2020, 2025 is important to be bear in mind. And to finish, I think that it's important to highlight another act, the act number 31750, which opens opportunities for the application of AI, actually integrating data from the electronic clinical record. This law actually allows for access to clinical information, obviously dissociated because of the personal data protection law, but which can allow different institutions, academic institutions, universities, or even private institutions focus on research and can help them to develop and promote research that is so important to develop and to generate new knowledge. And I would like to wrap up with this phrase, this quote that we hear constantly actually in different events related to AI, which is that AI will not replace the physicians, but we believe that AI will not replace the physicians, but physicians using AI will replace the physicians that do not use it. And we can extend this to the different professions, health professions. Let's remember that nowadays in a multidisciplinary world, we need to generate collaborations, and we need to generate and promote synergies, which is critical to be able to continue making progress with such an innovative aspect that will actually generate a great roadmap. And from we hope that we will be able to promote these things to contribute even more to the development and application of technologies, including AI, to improve services and to improve the quality of life of patients. Thank you very much. And I hope, well, I will be here for your questions if there is any, your comments, and I would like you to leave you my email, wcurioso@continental.edu.p, and my account in X or X former Twitter at Walter Curioso. Marilena, you have the floor. Thank you very much, doctor. Yes, I believe that we all have seen AI and we have heard about it, and we have always wish it would not replace us. But as you have said, we have to use it and use it well. It is important that it will provide information based on the quality of the information that we will input. So we have the control, we have to integrate everything that we know. We need to integrate the challenges, and the importance of all these contexts, as you have mentioned, the digital home or house, which is the infrastructure within this AI will become a collaborative tool, especially to disseminate the evidence and these great findings. Thank you very much, Dr. Walter Curioso. Please stay with us because we have received some questions for you. Dr. Dayal, can you hear us?
Yes, I can hear you. Can you hear me, please?
Gracias. Le escuchamos muy bien, doctor. Le pediríamos que
Yes, we
continúe.
can hear you, doctor. We would ask you to please continue. I had already given a brief summary of the first part of your presentation. I think that it's very important and it complements very well with what Dr. Kusunoki presented and Dr. Curioso mentioned the need to work in the challenges and innovation to continue making progress in the treatment of TB. Oh, you have the floor, Dr. Deya. You can continue with your presentation.
Right. May I start, please? Okay.
Yes,
first of all, my apologies for whatever happened. It was an excellent speech by Dr. Curioso. I was please. This was the last slide. Can we have the next slide, please? The next slide, please. Please. ये तो पहले हो रहा है.
Is that slide okay, or you one more?
Right. Am I audible, please? Can I go on?
Yes, please.
Hello. Can I go on, please? Can I continue?
Yes, you can continue.
Yes.
Sí, por favor, continúe.
Yes, please.
Okay, thank you. Now, the challenges in diagnosis, well, barriers due to comorbidity. See, children who have HIV, extrapulmonary TB, people previously infected with TB, contacts of TB patients, drug-resistant TB, they pose a unique challenge requiring advanced testing methods and longer diagnosis times. Next, please. So the diagnosis of early stages of TB disease, particularly in people who do not report the symptoms, and active case finding. This is again extremely important, especially more relevant to children. Next, please. Next, please. Health facility level barriers. Lack of adequate healthcare infrastructure and diagnostic facilities. As I mentioned, in our subcontinent, 70% of the population resides in the rural areas. Complicated long care seeking pathways requiring multiple visits. Shortage of doctors, lab technicians. This is where artificial intelligence would come in. Technical issues, logistical barriers, lack of infrastructure for installation, and suboptimal engagement of private health facilities. Recently, our government has put in a very nice public-private partnership for the diagnosis and management of TB, and it's working very well. Because in many setups, alone, the government setup was not able to cope with the load. So with the private people stepping in, it is doing a very good job. Next, please. Use of WRDs as initial test, both in public and private sectors. This, I'm afraid, was not happening in India and in the Indian subcontinent. Near patient and same day WRD through decentralization of diagnostic facilities. Diagnostic results to be provided in a timely manner. So reducing the turnaround time. Innovation in simple transportation, incorporation of results into records and prompt feedback. Quality improvement approach and root cause analysis in routine practice. Next, please. Reliance on smear or chest X-ray. In the Southeast Asia countries, where dissemination of information is not uniform, in many tribal and rural areas, still the medical practitioners are relying on the smear and the chest X-rays to make a diagnosis and start the treatment. This has to be done away with. Inadequate knowledge about TB diagnostic tests amongst the healthcare providers, lack of training on MRDs, non-adherence to diagnostic algorithms. I was the co-chairperson of the tuberculosis task force of the Asia Pacific Pediatric Association. and I requested the countries in the Asia-Pacific region to formulate their own algorithms. The WHO algorithms are there. Yes, they're very nice, but they have to be customized to every country. And that did make an impact. Non-adherence to diagnostic algorithms and laboratories SOPs can be a disaster. Use of empirical treatment. Now, this is something which has to be condemned very strongly. In low-income countries, many a time physicians opt for empirical treatment, in which they say, okay, let's try with anti-tubercular therapy. If it works, fine. Never mind. If it doesn't, we can always stop it. And trust me, it is very difficult to stop empirical anti-tubercular therapy once started. So in cases where the diagnosis is in doubt, it's best to wait for a while rather than opting for it. Now, I may sound absolutely contradictory to the lecture of Dr. Curioso, where he's talking about artificial intelligence, and I'm talking about empirical treatment. But this is the fact, sir, what is happening in the rural areas of Southeast Asia. Excessive workload often affects the competence and the efficiency of the healthcare providers. Next, please. So use of WRDs as initial test, education, training of laboratory workers as strategies to motivate and increase the MRDs and reduce empiric treatment. Next, please. Is the answer to what the problems I mentioned. Next, please. Data management, very, very important. Again, a continuation of, I would say a corollary of what Dr. Curioso mentioned. It is very important that the data recording and maintenance is done. Next, please. Service integration. Let me talk about the Indian subcontinent when the Pulse Polio program was on. We had a huge workforce which was implemented by the government to do door-to-door immunization for polio. Now, I'm so happy that this workforce is now being used for the management of TB because we are done away with polio. Now, this is how you improvise the facilities available. So this is what every country, particularly low-income countries, should look at to mobilize healthcare personnel from other areas where the diagnosis and where the problem is not of that magnitude as tuberculosis. Next, please. So we have registered many successes in the laboratories, but failed miserably in the field conditions to apply that knowledge. Next, please. Next, please. Next, please. So, in brief, if we move from microscopy to central lab-based tests to next, please.
Yes.
Next, please. गया तो नहीं. Right. Molecular testing must replace the smear microscopy. Only
Perdimos el audio. Creo que vamos a estar de a poquitos con esta. Pero el doctor ha estado atento, ha visto con la presentación del doctor Kuzno, que el doctor Walter Curioso. Y algo que debemos retomar es
Something that we should consider is the importance of using evidence, right? And transformed it in local regional policies which respond to the reality of the countries. I think that that is important. He also mentioned the importance of working with the vulnerable populations, but focusing on the approach is this rights approach, gender, interculturality, and participation.
Next, please.
Sí,
Gracias, me iba adelantando. Pase, pase, por favor. Claro que sí.
Now, these are the tests we know of. I'm particularly interested in the TB lamp test, which we have tested in our institution and found to be very useful. Next, please. The expert assays have reduced sensitivity in certain populations. Technology is expensive and requires laboratory facilities. And the recently launched Gene Expert is a battery-powered test, which makes it very portable. Next, please. Now, this is again a new test, the Gene Expert XTR assay, which detects resistance to INH, fluoroquinolones, ethionamide, and the SLIDs in 90 minutes. So this is again something which is of importance and is being worked on. Next, please. So this is where technology is definitely going to help us. Next, please. Well, again, like artificial intelligence, whole genome sequencing is now the new talk. It provides genotypic sensitivity to most drugs required for treatment of MDR-TB with a 96% concordance for culture-based sensitivity testing. Utility was initially limited with ongoing advancement in the microfluidic approaches to be available at POC as a point of care on a global basis. It is likely to provide revolutionary tailoring TB treatment to every individual based on the particular genome identified by the TB strain that they have contracted. Next, please. Next, please. Genetic factors. Now, for the last about 5-6 years, many studies have come up in which it is hinted that genetic factors play a role in acquiring tuberculosis. And these are some of the studies which are there. And in one study, it was mentioned that a substantial proportion of children with disseminated tuberculosis have a Mendelian predisposition to the disease. Next, please. Again, there have been articles where variants of the VDR gene homozygous for the FOK1 polymorphism were more found to Asians associated with this type of polymorphism were found to be more susceptible. Next, please. Next, please. This was a lovely article which was published in The Lancet in 2016. HIV infection, bacterial resistance of BCG vaccination in patients with recurrent and disseminated disease, persons traveling to endemic areas, and family members of open cases. Next, please. Next, please. Whole genome sequencing is currently being successfully implemented for the drug-resistant TB surveillance in at least 7 countries mentioned here, and select health systems in settings with low TB burden. For example, the UK, the Netherlands, phenotypic culture to whole genome sequencing for DST for the first-line drugs. Next, please. Next, please. Again, a new area where work is going on. Let us hope it comes into force soon. Next, please. Next, please. Yes. Expert XDR, which I've mentioned. The developers need to focus on drugs that are now critical for MDR and XDR management, including betacolin, pritomanid, and linezolid. Now, this is a test which is a point of care battery operated PSR. Next, please. Right. Now, there are ongoing efforts by multiple stakeholders to validate target sequencing as a complete end-to-end solution for DRTB detection. And one such essay is the Dplex MYCTB from France. It uses ultra-deep sequencing of 24-plex amplicon mixes for mycobacterial species identification, genotyping, and DST. Another one is the one which is from the US, which has recently been licensed by ABL. Both tests are currently for research use only. Next, please. Next, please. Next, please. Next, please. Right. Now, this is an area which is of particular interest in the Indian subcontinent and Southeast Asia as the TB LAMP test, a novel diagnostic test which in the pediatric population has shown very promising results and can be used as an alternative to the CBNAT. There have been studies which that this has higher sensitivity than AFB microscopy, and published in 2022 showed that combining MTB culture with TB LAMP gave a sensitivity of 61% and specificity of 96%. TB LAMP identified 39.3% and 43.2 cases with negative TB culture. Next, please. Next, please. Now, in our recent studies, we found that the CBNAT showed promising results as a diagnostic tool in detecting. However, it did not show good results with other, especially ascitic fluid, when examined. Next, please.
2 minutos, por favor.
You have 2 minutes
Next,
left,
please.
doctor.
Hello?
Yes, you have 2 minutes
Sorry,
left.
could you speak a little loudly?
You have 2
Sorry.
minutes left.
Okay,
Yes.
now this is fine. Okay, now this is another user study of ours in which the lamp showed excellent results. Can we go on fast, please? Just change when I say next, please. Next, please. Next, please. Next, please. These are some serum biomarkers which are being studied, and I'm sure they have promising results. Next, please. Next, please. Next, please. Next, right. Now, this is the e-nose test, which is another device based on VOCs that was found to have better sensitivity and negative predictive value than the tuberculosis skin test or the culture. Again, being evaluated in Indonesia. Next, please. Can we go to my last slide, please? Please go to my last slide. Very important that we replace. Yes, please go on. Please go to the last slide. Last slide, please. Right. Now, this is the summary, what I've been trying to say. And this is what the WHO also endorses, that we, by what we have just gone over, assessing testing that will increase access and it is extremely important that we look at the basic, simple things first, and then, of course, move on to the high-tech areas using innovations in technology. Last slide, please. Next, please. Well, ladies and gentlemen, I must thank you for your patient hearing. I'm sorry that the technical glitches of internet connectivity could not help me do justice with my presentation. But the summary of what I talked is that, yes, there's a lot to be done. We need to strengthen our sophisticated tests are coming, but as highlighted by the other speaker.
Muchas gracias, doctor de Ayala.
Thank you very much, Dr. Dayal. Excellent presentation. I think that it's important, as you have said very well in all your presentation, it is important to develop and favor access. Communication here plays a critical role, of course, in all this work that we do. Before going into the Q&A session, I first want to thank all the people connected with us. We have people from the Ministry of Health, Indian Community for NTB. We have people from Argentina, Chile, Colombia, Ecuador, Spain, England, India, Mexico, Nicaragua, Paraguay, Peru, Uruguay, Venezuela, among others. I mean, we are receiving many greetings and many congratulations for you, for all our speakers. Getting into our dialogue, please, I would request you to turn on your cameras. During these webinars, the attendees have asked some questions. Let's hope that we can answer at least some of them. I would like to start, Dr. Tsunoki. The work that you have presented, doctor, going beyond the Andean countries, it has provided experiences and lessons learned. What aspects should be considered then for new projects that could promote the use of technology and innovation in TB with everything that we have heard today? Well, I think that the question is very important because actually working with in the Andean areas, Andean agency, we work with the 6 Andean countries. That's our main objective. But in this project, we've worked with 17 countries. We have Secomisca and the Andean countries and some countries that do not belong to any of the two integration systems. But I believe, however, that it is important to see the innovation research part, because what you see in the visit to the countries, you can see that in reality, we know that there is innovation, but the main difficulty is budget, the budget managed by the ministries of health. So usually, if we consider this as an expense, we will never have the priority to provide budget to diagnosis of TB. We did a study in the first project that we had, in which we saw that spending or using or putting $1 to improve the laboratory, the country was going to save $7 actually in spending in TB. So it is more than as an expense, it's an investment. And this is something that should be seen very clearly, because if you diagnose more, we will have more cases, we will treat more, but by having this chain, more diagnosis, more treatment, we will prevent these people that are affected continued conveying or spreading the disease, especially if they are drug resistant. This is something then that should be bear in mind when you work in the ministries of health. You need to try to see that this more than an expense, is just an investment. It's a cost-effective thing. It's just to try to invest, to diagnose more, treat more, and in this way, we will be cutting this spreading of the disease chain. In this case, we have just only been seeing TB labs, even though it is true that the TB labs is one of the lines of the national laboratories. It is a laboratory that provides you diagnosis for one disease. There are labs in which you can make the diagnosis for all the diseases, that this can be done through the laboratory. So the idea is to work more in the laboratories, to make better diagnosis and quality diagnosis. And I think that we still lots of things to do. We still have many challenges ahead of us, but we need to work extensively on the advocacy to the ministries of health to continue working in this, because this is not only diagnosis, it's a whole social context that the TB has: discrimination, marginalization, social problems, poverty. We should try to solve all of this. But talking only about diagnosis and labs, I think that we need to invest more to have better diagnosis and a greater number of people diagnosed, but with
Muchas
quality.
gracias, doctora
Thank you,
Álvarez.
Doctor.
Doctor Walter,
Dr. Walter,
¿cuáles son los retos que enfrenta la academia para
which are the
promover los
challenges
proyectos de
that the
inteligencia
academia
artificial
faces
y la
to promote
innovación en
the
tuberculosis?
artificial intelligence and innovation in TB?
Gracias.
Thank
Como
you.
manifesté, el
As I said,
fortalecimiento de los
the
recursos humanos es
strengthening of the human
fundamental.
resources,
De
the
hecho,
capacity building for them,
especialistas
it's very
en
critical.
tecnología e
Actually, in
innovación,
these topics
el
of
Ministerio de
technology and
Salud
innovation, the Ministry of
en
Health
noviembre del año
in
2020
November
modificó la estrategia de
2020, it
competencias
modified the
y
profile of
requisitos de formación de los profesionales de
skills
salud
or
y,
competencies required for the health care
el primer
professionals.
documento,
And
digamos,
the
del
first
calendario
document
2020
was published in
define los perfiles de
2020,
competencias para los
defining the
médicos,
profile of competencies for the
enfermeras y
physicians and for
enfermeros.
nurses.
En ese sentido,
In that sense,
incluyó dentro del
it
componente de
included in
tecnología e
the
innovación
technology and
desarrollar la
innovation
aplicación
component actually the
de diversas
application
tecnologías e
of
innovaciones
different
que sean
technologies
científicamente
and innovations that could be
fundadas para mejorar los
scientifically
procesos y el uso de los
supported
servicios
to
de salud.
improve the
Si
processes
bien
and
es
the
cierto,
services of the health
este es un
services.
primer paso
Even though
porque
this is just a first step,
posiciona
because it
rol de
kind
las
of positions
tecnologías
the roles of
para que
the
sean
role of
adaptadas
technologies to
e
be adapted, to
implementadas
be
en
implemented
diferentes procesos
in different
generales y
processes in an
continuación.
ethical manner with a
Pero
professional use.
incluye
But it also
muchos
includes
profesionales de la
only
salud, ¿no? De hecho,
the telehealth
uno de ellos es
things.
precisamente una de
Actually,
las
one of the
tecnologías de información y
aspects
comunicación,
is to
pero
manage
que requiere
the
desarrollo de dispositivos,
communication
incluyendo la
technologies,
telemedicina,
but
la cogestión, la
using that
telecapacitación.
for health,
Por tanto,
telemedicine,
es muy
teletraining,
importante y de hecho han jugado
that
un
it's
rol
important. And actually,
fundamental
it
desde
has
que la
played a
pandemia, por
critical role during the pandemic for COVID-19, but there are some other challenges like the implementation of the National Registry of Electronic Records, medical records, or what we discussed today, the application of the AI tools in health. So challenges are still huge. It is critical that we modify the competence profiles, the study plans for the different schools of health sciences, not only medicine, because as I said before, work nowadays is multidisciplinary and we need many multiple disciplines that help us to be able to implement these aspects jointly. And to continue promoting not only at the graduate level, but at the postgraduate level as well. Let's remember that we need more and more to develop more master's degrees and PhD programs focused on the application of digital health, medical IT, and the role of the academia in this sense is critical, of course, but also the role of collaboration, the Ministry of Health or the SCONU, through the Ministry of Health. All of these institutions have a role to play that is key in this process. So the challenges are many, but it is important to join efforts and create synergies and collaboration among all of our institutions. Thank you, Dr. Walter. Dr. Dayal, there are many questions for you actually here, but let's start with the COVID-19 pandemic has contributed to the under notification of TB, but it has also strengthened the epidemiological surveillance in our countries. We have your experience, that the experience you have shared with us. What strategies should we implement to strengthen the progress made in the genomic aspect and to take advantage of them in the detection and adequate treatment of TB?
My God, that's a question which completely completely covers the diagnosis and management of TB. Could you please specify what the person wants me to answer? Because it's a huge question to answer. Could you please repeat the question part-wise?
Sí.
Yes, of course. First, I'm going to ask you about the strategies from your own experience, the strategies to strengthen the progress that has been made in research and to take advantage of these in the adequate treatment, diagnosis, and treatment of TB. That's one question. And there's a second question that I will mention later on. So can you tell us if you know about the progress made in the development of a vaccine for TB? That's a second question.
Right. So let me talk about the first question, please. That what are the strategies and the research areas which are being used to strengthen the diagnosis? Look, in Southeast Asia, the thrust earlier was on X-rays and the tuberculin skin testing for using in the initial test for the diagnosis of TB. That has been done away with. Now it's X-rays and the CBNAT test, which is being implemented all over. The governments in Southeast Asian countries are really putting their resources into doing and ensuring that the CBNAT test is available at the district level and in the peripheries also. From the research point of view, the TB LAMP test and the urinary LAMP has shown very promising results. In our institution as well, the TB LAMP test has shown very good results. Not only that, we have recently just completed a study in which we have looked at the value of CBNAT in the stool samples. And with excellent results, the results of CBNAT in stool are almost as good as in gastric aspirate. And this is the study which we are publishing very shortly in the Indian Journal of Pediatrics, which is the best Indian journal. So from the research point of view, LAMP test, doing the CBNAT test on stool samples is something which can be done in the field level and has shown very good results. Now, the second question was about the vaccine. Could you please repeat it? Could you please repeat the test, about vaccines?
Sí, sobre los avances.
Yes, if there's any progress made in the development of a TB vaccine.
there are at least 4 vaccines in the pipeline. But as of now, none have them been cleared. So the BCG remains, and with all the controversies surrounding BCG, we say that in low-income countries, BCG should be given to all babies at the time of birth. It may not protect much against pulmonary tuberculosis, but it definitely protects children against the serious forms of tuberculosis like biliary tuberculosis and CNS tuberculosis. So as of now, no other vaccine cleared except BCG.
¿sí? Queríamos que igual que con el COVID pudiéramos acelerar.
Yeah, it would be so good if we could speed up the efforts to get the vaccine like we did with COVID. Dr. Dajjal, you mentioned the importance of approaching important challenges. And we have to discuss the cost, no? Like be careful with the initial costs, initial investment, the maintenance costs, then, and the cost to implement new technologies. This might be a barrier, the cost, I mean, one of the problems. From your experience, could you give us some comments on the involvement of the private sector and the strengthening of the research capacity, how the private sector can contribute to research, in other words?
A very good question indeed. The private sector has really stepped in the Indian subcontinent to help the government infrastructure in the diagnosis and management of TB. We have excellent organizations, and one of them is SATHI. I wonder if you've heard about it. It's SAATHI, a private concern which has really complemented in the diagnosing of TB by conducting these tests at the field level. By field level, I mean in the peripheral areas. So where the government was not able to cope with doing the tests at the peripheral level, these people have come in, not only with providing the test, but also the manpower. And this has really helped. Not only that, they have also complemented in the providing of drugs at the peripheral levels. They have further helped in the notification of cases. Let me tell you, ladies and gentlemen, notification is extremely, extremely important. We may have any level of high-level innovations in technology, but if the cases are not notified and we do not know what the exact ground situation is, well, it's difficult to move forward. So the public-private partnership has been encouraged very strongly by the Indian government, because we were hoping before the COVID that we would be able to finish off with TB by 2025 with the involvement of the private sector. Unfortunately, the COVID derailed us, but still we are moving very fast, although I feel it's difficult to finish off with TB in India in 2025.
Gracias. Una pregunta para todos, todas.
Thank you. This is a question for you all, for all our speakers. Today, we have seen that there are multiple obstacles and barriers to achieve our goal, which is to end TB. Which do you consider the most important barriers or obstacles to approach or to deal with from your own experience? To all our doctors, please. I believe that this problem has many different aspects to be considered, and what we know is that we need still lots of evidence. We need more evidence to know what you can do and where are you at this point. So with the experience that we have gained from the 2 projects that we have had, what we have been able to learn is that we need to do a lot of advocacy. We need to go to the ministers and the top levels. We need to explain them. What is it? What TB is, what does TB mean in each one of the countries, and each one of the countries is different. What does it mean? What can you do? And even more with this study that we did on the funding flow from the national or supranational referral laboratories, we can show them what the lab needs to be able to work correctly and to provide quality diagnosis. So with these things and having evidence of this, with the evidence, we can go to the ministers and we can work with them for them to allocate budget to this. Because usually when you travel and you go to other countries, when you tell someone you should go to the minister to explain how TB, the TB situation is. Usually, most of the people just present the situation of TB, but in reality, the minister will pay attention to that for a minute and then they will go to something else. So I think that we need to prioritize the messages that we convey. We need to prioritize things and to see how can we make an impact in each one of your authorities. So what would impact them the most so that they will take this topic and will consider this not as an expense, but as an investment to be able to provide better and more adequate budget. This would be not only for TB, but for all other diseases as well. I believe that it's important, though the work, the laboratory work, it's important, and we need to strengthen our human resources. The human resources are so important. There's a deficit of human resources. There is a deficit of trained human resources. The legal part of the countries as well, they do not have a way to substitute or to replace for people that are being on a leave or that are just retiring. So if someone leaves, there's no replacement for these people. And the other thing is the external quality control. The external quality control is so important to look at the quality of the information or the data or the tests that are being conducted. I think that if there was something more, I would mention that later on. Thank you, Dr. Walter.
Muchísimas gracias, Marianela.
Thank you, Marianela. I agree with Dr. Kuzinovsky, and I would like to, in reality,
mencionar también que en
to
realidad
also mention that in reality,
para
the
mejorar
approach to improve
los diferentes procesos de
the
tuberculosis
different
requieren
TB
un
processes
esfuerzo
requires an
intersectorial
intersectorial
a diferentes niveles, ¿no?
approach at different
Bien, el gobierno
levels,
tiene un rol,
even though it
el
is
gobierno
true that
nacional,
the
pero
national
los
government has a role, but the regional
departamentales, tienen mucho que
and
aportar.
local governments have a lot to
Aparte
contribute to,
de mejorar
apart
el
from
acceso a
improving the
servicios
access
de
to
salud de calidad que
quality
siempre va a
health
ser
services that will
importante.
always be
Se
important.
mencionó también
We also
optimizar los
mentioned
procesos
optimizing
que permitan el diagnóstico
the processes
temprano
that will
y
allow for an
preciso,
early and
sobre
accurate
todo considerando que los
diagnosis,
antibióticos
especially
están en
considering
aumento y
the
es también
MDR
importante
TB cases,
ir a
which
una
is
supervisión
important,
y
no, which
utilización
requires
muy cuidadosa
very
también
careful
de la
management
propagación
to
de
prevent
más
the
casos.
spreading of more
La
cases.
falta de conciencia
The lack of
pública,
public
los
awareness
mecanismos
as
para
well, mechanisms
brindar
maybe to
una
provide
eficiente
a
información y educación
efficient information and education
a la población es
to
fundamental.
the
Esta parte de
population that is critical,
capacitación
this
se
literacy
redujo
process,
y se
the
ahora
health
también habla de
literacy,
educación
and
digital.
even now a digital
Es
literacy
esencial
in health, that's
fomentar esa
critical
conciencia pública,
actually
no
to
solamente
improve
la
this public
recolección de los
awareness, and
síntomas,
not only the
sino
recognition of symptoms,
lo
prevention,
importante que es
and the
también el
importance of
tratamiento de la
the
tuberculosis.
timely treatment of TB.
Mencioné el enfoque
I also
multisectorial,
mentioned the
pero todavía
multisectorial
es
approach because
importante,
it is still important
recordemos, mejorar las condiciones de
to
poblaciones, sobre
improve
todo que
the
son más
situation
vulnerables
of the
en
populations,
información
especially
de
those that are
emergencia,
more vulnerable,
teniendo
still living in
malas
poverty,
condiciones de salud,
overcrowding, and
controlar también
malnutrition. Control as well
comorbilidades,
the
¿no?
comorbidities
El paciente
around
con
a
tuberculosis también es
patient with
importante,
TB.
no
That is
solamente
also important, not
VIH, SIDA,
only HIV, AIDS, etc.
financiamiento que ya se mencionó, que
The
siempre va a ser un
funding that
tema
we've
constante,
mentioned that will
falta de
always be a
recursos,
constant
instituciones de
aspect, the
gobierno,
lack of
abordaje
resources. It's important to have
colaborativo, el tema
a
de la
collaborative
adherencia al
approach, the
tratamiento también es un
adherence to
tema que no
treatment,
podemos dejar de
something that we
mencionar.
cannot
Fortalecer también las regiones,
not mention.
promoviendo
Also
esta
strengthening the
descentralización de los
regions
servicios de
by
salud,
promoting the decentralization of the
áreas
health services, the
integradas de
strengthening of
salud
the networks,
y el tema que
and
mencioné
what I
inicialmente,
mentioned
el tema de
initially,
mejorar la
which
formación médica
is
para los diferentes
improving the
procesos
medical
de
training for
detección,
the different
diagnóstico y tratamiento es
processes,
fundamental.
detection, diagnosis,
Garantizar de que todos los profesionales estén
guarantee
pendientes
human
para
resources that are well
afrontar
prepared,
esta
well
enfermedad de
trained to
forma
deal with this
efectiva.
disease in an effective
Permítame,
manner.
doctor Walter, y
Allow
dada
me,
su
Dr. Walter,
experiencia
and given
usted
your
en el
experience
CONCITEC, ¿no?
in
El
Concitec,
Consejo Nacional de Ciencia, Tecnología e Innovación Tecnológica de la Presidencia del Consejo de
the
Ministros de Perú,
technological
¿hay estímulos para la
innovation
implementación de áreas
entity, is
avanzadas
there a
a ambos
stimulation,
lados, ¿no?
some promotion for the
Si bien
innovation?
existe, sin
Yes,
embargo necesitamos mucho
there
más
is, but
apoyo,
we need
¿no?
much more support. You
El CONCITEC
know,
juega un rol
Concitec plays
ciertamente en
a
las
role,
instituciones
but
de
there are
gobierno
other
en promover
institutions that
fondos
can
como el
also
Instituto Nacional de Salud,
provide funds, like the
¿no? El
National
Ministerio de Salud,
Institute of
de
Health,
hecho,
the Ministry of Health, indeed.
a raíz de esta agenda digital,
because of this digital agenda, they are also activating other support initiatives for social innovation, social support, which is an important angle. What we need much more investment actually to generate new knowledge and work through Concitec or even through the Ministry of Production, through Provinovate. We also need that because actually this innovation, technology innovation and this process innovation is critical to generate new knowledge and to develop actually evidence that will allow us to then make decisions and incorporate this evidence in public policy.
Gracias. Doctor Dayal.
Dr. Dayal, please.
Right. So the question is what to do and to do it fast. I mentioned that India has the largest number of patients of tuberculosis in the world. Now, I've been in the area of infectious diseases for the last about 40 years now, 40 years. And if you ask me what to do to achieve the goal by 2030, the first is health education. In a country like ours, and also in Southeast Asia, where majority of the people are living in the rural areas, educating the masses is extremely important so that they understand the disease. The second important thing to do is to take the diagnosis to the doorstep. If we wait for the patients to come to the cities, it'll be too late. So the diagnosis has to reach them at the doorstep, which means providing the CBNAT tests. For example, in the stool samples in children, which is what we are advising now, as a very simple test to be taken to the peripheral areas. Simultaneously, the healthcare workers from other areas should be mobilized. As I mentioned, in India, we mobilized the people who were working for the pulse polio program. Now they are working in the field of tuberculosis. So health education, taking the diagnosis to the doorstep in the field areas, and ensuring that there is a good supply of drugs. These are the three basic areas which need to be strengthened if we want to get on top of this. Thank you.
Las gracias a todos.
Thank you very much to everybody.
Les voy a pedir solo en un minuto, por favor, miremos la hora, un mensaje final.
I would like to request a final message from you, a message for the population that is listening to us. Just 1 minute or a message, a final message from you all. I would like to thank the countries that have participated in the grant, in the first and the second one, both because in reality they have allowed us to get to know more what is happening at the level of the laboratories, to see what happens, what do we need, how can we support you from the integration systems or from the part in which you are working. We know that TB is a very large public health problem, and we would like to, you ask us if we could continue working with the countries in a new project that in reality we do not know, because that depends on the funding that we might be able to get. We have in mind many things, yes, but we do not know if it's going to be possible because we have to look for funding. But at the end, I believe that we are leaving you with some very important things, and each country would have to continue and maintain this in time. Thank you. Dr. Walter. Well, for me, it's been a pleasure to participate in this panel. The message that I would like to share with you is that TB is a disease that affects all the communities from all over the world, but Peru is not the exception, but we can mark a difference and continue making progress towards a future that at some point will allow us to end TB. But for that, we need a firm commitment, not only from the governments, the regional organizations or international, organizations, but also the participation of the community, which is critical. We need to strengthen our health system, in which the information systems plays a very important role. Many times maybe we'll not see this, but actually when we make decisions, we need to be based in data, and the data that we still have are insufficient or incomplete or not untimely. Therefore, it is critical to strengthen the whole information system in health, improving and implementing technological tools, using artificial intelligence, implementing the integration of the different registries and systems, because systems are still disconnected, or application, or these are softwares or applications that are isolated. We need a comprehensive system that integrates information. And finally, education and awareness, which are essential. We need to work together to get to learn more about TB in our communities, and to also inform the population in a timely manner with digital literacy. And this is something that does not only should not only be done by the Ministry of Health, but other agencies. That's why we have different sectors meeting nowadays at the national level, and also to strengthen the alliances and the partnerships and collaborations and synergies between or among different countries. Thank you. Dr. Rajet, your last comments, please. Dr. Dayal.
Right. First of all, a big thank you for inviting me. I'm sorry that the internet connection let me down and I could not make my presentation fully. So the first thing is I would request you to give me another chance whenever possible, and I'm sure I'll do better than this time. Now, my only message is that TB is going to stay with us. It's not going to go away. So have a high index of suspicion. And to all the people who are listening to this program, please spread the awareness about this disease and do not hesitate to investigate. In many countries, it becomes a social stigma if a patient is being investigated for TB. Please get on top of that. So spread the health education around and do not hesitate to investigate, so that even if you have negative diagnosis, no problem. It is always better to have a few positive diagnoses rather than missing. And look at the health system in totality. Let us not just focus on TB, focus on the issues surrounding. Look at the immunization and the infectious diseases surrounding these children and adults are taken care of. Look at HIV. It has to be looked at in a total scenario. So to all the people who are listening to this program, please do not just focus on TB alone. It is there, it's going to stay with us, but look at all that is surrounding TB as well and put in all your efforts. I'm sure that with an integrated effort by the healthcare providers, by the community, by the ministry, by the doctors, we shall be able to move forward. Thank you so much.
A usted las gracias. Reiteramos el agradecimiento.
Thank you very much again. Thank you very much for the excellent presentations today. We have received lots of congratulations in the networks. Thank you, Dr. Lourdes, Dr. Curioso, Dr. Rajev Dajal, and to all the participants and the Orasconu team and all the people that participated in this activity.
Cedo la palabra a la doctora María del Carmen Calle para que dé por finalizado este importante webinar.
We will now go to Dr. Calle to finish to close the meeting.
No son problemas de conexión. Lo que pasa es que justo tenía que contestar algo que tenía que contestar.
Sorry. My first words are of appreciation. Thank you very much. Lourdes, Walter, Professor Dayal. For us, it's been an honor to have your presence, the presence of you, the three of you here. I will use simple words for this. If you don't look for it, you won't find it. If you don't find it, you will not diagnose it. If you do not diagnose it, you won't treat it. If you don't treat it, TB won't end. So this is a comprehensive approach. It is a comprehensive approach in which everything is important at the same time. I am very much concerned when people speak about TB just as a social disease, because we limit ourselves to looking for just among the poorest people or the people that have some sort of vulnerability, and we forget about the other people. I have loved this topic of pediatrics TB. Professor Dayal has said this very well. If you don't look for it, you don't diagnose it, and you get there when it's too late. And the infant or childhood TB is something that it's increasing clearly all over the world. On the other hand, it is very important to combine. This is comprehensive. I have to have a good record. I have to ask about background or history. I have to have in my differential diagnosis TB, and I have to ask for the best tests to diagnose, undoubtedly. We have these rapid tests that will allow us to make a faster diagnosis, and will also allow us to see whether there is drug resistance or not. But we also need to think in the follow-up. We have already shown in our visits, because we're closing the second project, we need to think about our visits when we check how many cases are diagnosed, how many abandonments do we have, how much success we have achieved, and then we realize that there's still a huge gap. And one of the prioritary aspects is prevention in contacts. And in contacts, TB TB usually happens in young people, and young people have family and children. So I think it's a comprehensive thing, using more modern things, and something that has been repeated extensively by Dr. Dayal is to look, if you will continue, that they come to our hospitals, to come to our health centers, we are lost. And for that, we have the participation, community participation. So everything is important. Let's not forget about anything. The thing is that first we need to look for, we need to suspect, we have to diagnose. I need to continue and take care of all contacts. I'm so sorry, but the booth, the translation booth will be closing at this point. Sorry, I'm so sorry, but I have to leave. Thank you.
Y tenemos que tener otra forma, otro enfoque para atender a nuestros pacientes. Y lo último que dijo el profesor, como dijo, que todos los que nos están escuchando, se lo digamos a todo el mundo, digamos, cumplamos con todo lo que tenemos que hacer. Bueno, profesor Dayan, esa es la razón de estos webinars. Lo que nosotros queremos es que la información más actualizada con las personas con mayor experiencia llegue a donde debe llegar. Y hay un tema que ha dicho Walter muy importante: mejorar las capacidades, porque capacitación es posterior, las capacidades que deben lograr en su formación los profesionales. Y no solo estamos hablando de los profesionales médicos, estamos hablando de los profesionales también no médicos. Nosotros desde el organismo andino estamos con estos dos proyectos que ha liderado la doctora Kusunoki, convencidos totalmente que hemos puesto de nuestra parte para mejorar las capacidades de los laboratorios en el primer proyecto con 20 países, en el segundo proyecto con 17. Pero volvemos a lo mismo. Si no tenemos sostenibilidad, si no tenemos recursos, como ella ha mencionado, si no tenemos financiamiento, retrocedemos. Así que no nos olvidemos que este es todo un proceso, esto es un circo, esto es una cosa completa, todo es importante. Y cerramos diciendo de que si no lo buscas, no lo diagnosticas, si no lo diagnosticas, no lo tratas, y si no lo tratas, nunca vamos a terminar con la tuberculosis. Muchísimas gracias por su presencia. Nos estamos viendo la próxima semana para un webinar en relación a nuestra población afrodescendiente. Buenas tardes, buenos días, buenas noches. Muchas gracias, Marianela, y a todo el equipo de Horas. Gracias. Namaste.